This is an in-service on the low-fiber diet. Fiber is the part of fruits, vegetables, and grains that does not get digested in the human body. A low-fiber diet restricts foods that are high in fiber to help reduce the amount and frequency of stool. Some health conditions that may require a low-fiber diet are for diseases that narrow the bowel, like Crohn's disease, irritable bowel syndrome, or ulcerative colitis. A patient may need a low-fiber diet during the recovery period after having bowel surgery. And some treatments like radiation for cancer may damage or irritate the bowel, and the patient may need to follow a low-fiber diet while they're healing from that. As the digestive system returns to normal, however, fiber can slowly be added back to the diet. A true low-fiber diet allows 10 to 15 grams of fiber a day. At Brigham and Women's Faulkner, we don't count the amount of grams of fiber. We just exclude foods that are high in fiber and include foods that are low in fiber. So foods that are allowed include white bread without seeds and nuts, white rice, plain pasta, crackers, refined hot cereals like cream of wheat, or cold cereals that have less than 1 gram of fiber per serving, pancakes and waffles, well-cooked vegetables, and fruits without seeds or skin. Also, fruits that are canned are allowed, and fruit and vegetable juice with little or no pulp. Foods that are not allowed include whole wheat or whole grain bread, brown or wild rice or other whole grains like kasha, barley, and quinoa, dried fruit and prune juice, raw fruit and berries, raw vegetables and corn, dried beans, peas, and lentils, seeds and nuts, coconut, and popcorn. You may have heard the term low residue diet. Years ago, the low fiber diet was called the low residue diet. And the low residue diet limited fiber, but it also limited higher fat foods and dairy products. But there really is no scientifically acceptable definition of residue and no way to measure or estimate residue. So, and they also were not able to have any data to support that the low residue diet was effective in helping the bowel to heal. So that's why they switched to the low fiber diet, and it's really the preferred way since fiber can actually be measured, monitored, and reduced in the diet. Some other considerations: the low fiber diet is only intended to be followed for a short period of time while the patient's bowel is healing. Following a low fiber diet for a long period of time can actually cause more problems because the patient would become constipated and can create a whole different other set of problems. Many times patients who need a low fiber diet may also need a lower lactose diet, since injuries in the bowel also affect lactose digestion.